I am Dr. R K Mathur, Senior Orthopaedic Surgeon, Jaipur. Today we are going to talk about the basic structure of the knee joint and the common conditions affecting the knee joint. So as you can see, this is a model of the knee joint. The knee joint is basically made from three bones. First is the thigh bone, also known as femur. Other is the leg bone, known as tibia. The third bone is the patella, which is in the front of the knee. Second, the other structures which are important in the knee joint are the ligaments. One ligament which is in the front of the knee joint is the anterior cruciate ligament. Other ligament on the back of the knee joint is the posterior cruciate ligament. Then there is a ligament on the inner side of the knee joint, which is the medial collateral ligament. There is a ligament on the outer side of the knee joint, which is the lateral collateral ligament. So the ligament injuries can occur in, singly, or they can occur in combination. For example, in a patient, only one ligament can be injured, or in some cases 2 ligaments or 3 ligaments can be injured at the same time. Then there are structures in between the thigh bone and the leg bone, which in common language we call them as washers. In technical language we call them as meniscus. These are on the one on the inner side is known as the medial meniscus. The one on the outer side is known as the lateral meniscus. In cases in which there is a twisting injury to the knee joint, sometimes this tissue or the meniscus is torn. If it is possible, it is repaired, or if there is a small injury of the meniscus, sometimes the partial part which is damaged is excised. Then the third thing which is important is the cartilage. These cartilage are spongy tissue on the ends of the bone here, and also on the upper end of the tibia, on the back of the patella. So in rare cases there can be injury to the cartilage also. Then the fourth thing which is important are the tendons. In the front there is a tendon extending up to the patella, which is the quadriceps tendon. There is another tendon extending from patella to the leg bone, which is the patellar tendon. So there can be injury to this tendon, or there can be injury to this tendon. So the injuries which are common are the fractures involving the bones. Then there can be ligament injuries involving the ligaments, ACL or PCL or MCL or LCL. Then there can be cartilage injuries. Then there can be injuries to the tendons also. Right. Then so most of the patients what we see in younger age group, we have sports injuries patients. In the older age group, the patients usually come to us for arthritis. In arthritis, the cartilage is damaged and the joint space is reduced, and the patient has recurrent episodes of swelling and pain. At the same time, the joint is deformed, so there is deformity, the joint is unstable, there is a limp while the patient walks. So in these cases, depending on the extent of the arthritis, either half joint replacement or full joint replacement is done. Sometimes when the joint is not much damaged, it can also be treated by alignment surgeries like HTO. Thank you.